Good afternoon, everyone, and welcome to this month's Holland Health webinar. Welcome from a very cold South Africa, I can tell you that. It is winter season here, fast approaching, but we hardly had autumn, so it's super, super cold, so don't be surprised why I'm nice and warm. Thank you for joining us this Friday afternoon as we continue our wellness webinar series focused on supporting healthier, more balanced lifestyles. Today's session, Silent Rise of Chronic Illness, How Preventative Screenings Can Save Your Life, highlights the importance of early detection and proactive healthcare in preventing and managing chronic illness. We'll be exploring how regular screenings and preventative care can help identify health risks early and improve long-term well-being. We're delighted to be joined by Dr. Lorna McCrindle, who will be sharing practical insights and guidance on this important topic. Let's get started. Over to you, Dr. Lorna.
Thank you, Nono. So chronic illness is obviously a big term for a lot of different conditions, and it's defined by a long-lasting condition, something that lasts for longer than 3 months. It is often a slow progression, and it requires regular monitoring and management. Examples are diabetes, which could be type 1 or type 2, hypertension, which is high blood pressure, insulin resistance, obesity, heart disease, high cholesterol, and certain cancers. We are talking about the silent problem because a lot of these conditions start existing without showing symptoms. So we say it's actually a blessing to have symptoms because then you are warned that something is wrong. Chronic diseases can progress for years without symptoms. And a quote from the WHO is that 46% of adults with hypertension don't know that they have the disease. The global reality, and this is happening obviously globally and in Africa, is that there is an epidemiological transition, which means that we are having less deaths from infections or communicable diseases and injuries, and more relatively from chronic diseases. And that these diseases are beginning to appear in younger people, not just in old age. And also because people are living longer, we are obviously seeing these diseases with a greater incidence. And then just to say of the chronic diseases, the death nights, the things that people most commonly die from are cardiovascular disease, cancers, diabetes, and dementia. As I said, in the African context, this is also very relevant. Although we do still have a lot of infectious diseases in Africa, there's a consistent increase in non-communicable diseases. That means non-infectious diseases or other chronic illnesses. And we've definitely in Africa got the coexistence of the two profiles, infectious and chronic. And as I mentioned, the younger populations are also being affected. Why are these conditions increasing? It's largely related to our lifestyles, the modern lifestyle. And that is through our diet, which is heavy in processed and fast foods. It's due to our sedentary lifestyle. People are just less active, whether that's by choice or just because they're having to work and remain at a desk. And there's generally a lack of physical activity. We all have, I'm sure, experienced stress, and chronic stress also raises cortisol in the body and can lead to chronic conditions. Sleep deprivation and obviously alcohol and tobacco use these are all habits that contribute into this whole series of chronic illnesses. So the danger of feeling fine. So the absence of symptoms does not mean the absence of disease, which is why we're going to talk about screening and why screening is so important for a whole lot of reasons. Many, as I said earlier, of these diseases develop silently, and they are picked up when you have screening or you have tests before you have any symptoms. The diseases that can be asymptomatic, so meaning no symptoms, can be high blood pressure, it can be early diabetes, it can definitely be high cholesterol or dyslipidemia, chronic kidney disease, heart disease, certain cancers, and hyperuricemia, which is gout. So just to explain sort of the background of why these lifestyle factors that I mentioned around sedentary living and poor diet, excess alcohol intake, poor sleep, all of these things cause an accumulation of visceral body fat. That is belly fat, and visceral fat is not fat under the skin, but it's fat on the inside, and it surrounds your internal organs. And it's different from fat that is subcutaneous or under the skin in that it is metabolically active. So this fat actually secretes inflammatory chemicals, enzymes into the body, and it causes two things. It causes something called insulin resistance. So our cells become resistant to insulin, and our cells need to be able to receive insulin because that allows glucose to be put into the cells. So insulin resistance leads to glucose being high in the blood and often being stored as fat, which just accelerates the problem. The other problem with visceral fat is the inflammatory chemicals that actually cause a chronic inflammation in the body. And chronic inflammation causes damage to the lining of blood vessels and it is linked to heart disease, strokes, diabetes, and other conditions, including certain cancers. So it is important to reduce belly fat and try and keep your waist measurement within a healthy range. For men, that is less than 94 centimeters, and for women, less than 80 centimeters. So preventative screenings are essentially medical tests before symptoms appear. And the reason that screening matters is because obviously early detection means we can implement care, we can change behavior, we can start medication, and ultimately save lives and prevent illness from getting worse. It's definitely lower costs to the healthcare system when we manage diseases earlier rather than when they are late and very advanced. And as I said, it's much easier and more effective to get to control a chronic condition before it becomes too serious. So some screening examples would be blood pressure measurement, blood glucose measurement, knowing your weight, knowing your waist circumference, knowing your body mass index. That is a number that is relative to your height and your weight, and we know what a healthy body mass index should be. Cholesterol levels is a blood test, also an important screening marker. Certain cancer screenings, which I'm going to talk about in a second. And then taking a family history is a very important tool that is available to anybody. So when you consult with a doctor or a nurse practitioner, they will often ask about your family history. And this is important for people to know and to actually take seriously. And you can know your own family history, and then you can know what I should be aware of. Lots and lots of chronic diseases run in families. And those could be cancers like breast cancer, prostate cancer, colon cancer. We know that diabetes, obesity, hypertension, sleep apnea, these all run in families. And if you are aware of your grandparents, your parents, your brothers, sisters, medical conditions, it helps you be informed to make decisions for yourself. In terms of regular checkups, so I would always promote this, and at different stages of life, it depends who you need to see or how often, but basically just some kind of annual health assessment, monitoring of anything if it's a little bit flagged, and then, as I said, it's tailored by your age and your risk factors. For an example, continuous monitoring, if you go in and you have a blood pressure check and it's just on the borderline of normal or high, we don't ever make a diagnosis just on one day by saying, oh, your blood pressure is higher than normal, you must have high blood pressure, here's medication. It needs to be monitored continuously and seen if it is a real condition or whether it is impacted just by your poor night's sleep the night before, your cup of coffee, traffic, etc. So continuous monitoring for anything that's flagged is important because once-off reading does not necessarily mean you have the condition. So if we go just generally by age groups, young adults, I would always just give a basic examination, some maybe basic tests, obviously hone in on anything where there's a family history, and I would always offer lifestyle advice. As you get a little bit older, into the 40s, cancers become more relevant. It's important to screen for colon cancer, which can be either with a colonoscopy, but it could also be something called a fecal occult blood screening, which is a stool test looking for any signs of blood, microscopic blood in the stool, which could raise a doctor's suspicion for a colon cancer. Cervical cancer is a pap smear. Breast cancer in an over 40-year-old woman is definitely an examination by a medical professional, and then usually a mammogram or ultrasound. And skin cancer is also very important to look at somebody's skin, especially if they are very fair or if they have a family history of skin cancer. And then as you get older, over 45, 50, definitely we need to be assessing for metabolic conditions and cardiovascular conditions. And then just if I talk about women's health, as I mentioned, the cancer screenings, breast, cervical cancer are important in women. Also, colon cancer, as I said, can be a stool test or it can be a full colonoscopy, and particularly important if there's been a family history. And then in terms of hormonal health, so particularly around the menopause, the perimenopause, the menopause in a woman, cardiovascular and metabolic screenings become very important. As a woman's estrogen and progesterone decline, their risks for high blood pressure, for diabetes, for that increased abdominal fat, for sleep apnea, all of those risks increase. And it's very important to screen the menopausal woman for those conditions. Men's health, prostate cancer, it's not written up here, but testicular cancer are both important to screen. And those prostate cancers are a blood test as well as a prostate examination. Testicular cancer is an examination initially by a doctor, and any further imaging, ultrasounds or MRI scans, etc., if there's any concern. Men's health, cardiovascular, very important to do a basic examination, which would be blood pressure, heart rate, listening to the heart, an ECG. And then if there were concerns, more extensive investigations would be things like a cardiac stress test, which is essentially doing an ECG while the patient is exercising. That's very good at assessing if there's anything, any kind of warning signs of early heart disease that would warrant referral. And then a carotid artery sonar is an ultrasound of the carotid artery in the neck. Also a very, very good screening for high cholesterol, plaque formation, and early signs of cerebrovascular or disease. And then, as mentioned earlier, colonoscopy, very important in the over 45s. So if screenings exist, why aren't they being done? There's a lot of barriers. People are not aware, or the lack of information about how important they are. There's associated costs. There's fears of diagnosis. Some people want to just not know until it comes up. And obviously busy lives, lack of time, and sometimes not prioritizing our health. So what happens if we don't screen? We will develop symptoms of a disease, and those symptoms can be early symptoms. And for example, in diabetes, it might be increased thirst, it might be weight loss, it might be poor wound healing, it could be pins and needles in the feet, could be blurred vision. Hypertension can present with headaches or vision problems. Heart disease can present with angina, which is chest pain on exertion. And if we really don't screen, we can actually present with a severe consequence of an undiagnosed chronic disease. And that could be something like a heart attack from untreated heart disease, heart failure, a stroke, kidney failure, which can be a result of untreated diabetes or untreated hypertension. And we can also present with advanced cancers, something that could have been picked up much earlier by a screening mammogram or a pap smear might present when the cancer is palpable or the cancer is coming through the skin or the woman presents with bleeding, etc. And the problem is the result of this is the disease is more advanced, it's harder to treat, and it's associated with worse outcomes. Common myths are that I'll only get tested if I am sick, or I'm too young to worry, or I have no family history and I am safe. So just to talk about, just to mention that cancers, it's a huge, much higher proportion of people have cancer as a just sort of spontaneously rather than having a family history. So more people get cancer who don't have a direct family history. So changing the mindset. We want to try and prevent illnesses altogether. And that I'm going to just talk about just now in terms of general lifestyle advice. We want to prevent illness altogether, but we also want to prevent illness from becoming serious. So instead of reacting to a problem, we'd like to take action, find out if there's anything going on. How can I now change my lifestyle to reduce this condition getting worse? How do I need to take any medication to prevent this condition getting worse? We need to be accountable to ourselves and our families because it's our responsibility to take care of ourselves. If you're parents, it's your responsibility to be around to look after your families. So our choices are the main determining factor of screening and of trying to prevent illness. And then our lifestyle is important. So prevention beyond just screening for diseases. The 6 pillars of healthy living, which I'm sure most people do know, is a healthy diet. For example, the Mediterranean diet, which is a diet with a lot of focus on fruit, vegetables, whole grains, lean protein sources like chicken and fish, healthy fats, which are your olive oil, your olives, your avocados, your raw nuts, as well as and not too carbohydrate heavy. So the Mediterranean diet is a good sort of diet to try and eat 80% of the time. Then maintaining a healthy weight. So as I mentioned, the body mass index, a normal range is between 19 and 25, and that is your weight divided by your height squared. You can easily find that, do that on an online calculator. And so maintaining a healthy weight is important. Regular exercise. So the recommendation is 150 minutes of cardio per week and 2 to 3 sessions of strength training per week. So we know that cardiovascular exercise is important to burn fat and excess calories, and strength training, particularly important to build lean muscle mass, which, muscle is a very healthy tissue to have. The more sort of muscle you have, the better your metabolism, as well as strength training, particularly for women in terms of bone density. So as a woman gets older, her bones get thinner, and strength training or walking with weighted vests or lifting dumbbells, etc., definitely loads those bones and decreases the risk of developing osteoporosis. Stress management is very, very important in the lives that we all live. And that will look different for different people, whether that is a meditation, a journaling, mindfulness, counseling, time with friends, exercise, whatever it is, managing stress, and following that, quality sleep. So 7 to 9 hours of quality sleep at night. And obviously 7 to 9 hours is the recommended time. Quality needs to be a good amount of deep sleep in your night, and a particular, so if you are sleeping sufficient hours of sleep and yet still have daytime tiredness, it's recommended that you consult with a medical professional and possibly have a sleep study to make sure you don't have a sleep disordered breathing or a sleep apnea syndrome that is impacting the quality of sleep at night. And then obviously no smoking. So getting help to quit smoking. So I would like to hand over to Nolo. Nolo, if you, I know you would like to share some of Hollard Health's offerings for preventative screening. So over to you.
Thank you, Dr. Lorna. At Hollard Health, we are committed in supporting you to ensure that at least, you have early detection or you're able to detect any of these conditions that you may be suffering from, that can turn into silent killers. And one of the most impactful ways that we do support you as our member is we do provide you the wellness and preventative care, which does come built into your plan as a Hollard Health member, not just for you, but for your dependents as well, above the ages of 18, including your spouses. You can go to the next screen for me, Dr. Lorna. Thank you. Now, on the Hollard Health member portal or on the app, you'll be able to download what we consider to be a document that will make it easy for you to be able to have these wellness and preventative tests conducted by your healthcare professional. What you will do is you will log on to the Hollard Health app or the portal, go to My Services, choose a service provider in your area that you would like to, consult with and have these certain tests or these indicated tests, conducted. On the portal, under coverage, you can download a document titled Hollard Health Preventative Care Tests Covered. This is a way for us to make it easy for you to have at face value or, in advance, a list of all the tests that we do cover as Hollard. Once you've downloaded this, please do share it with your healthcare professional because it is important that number one, you do have or obtain a guarantee of payment or what we would also call a pre-approval from the call center. So our idea is to sort of answer the golden question that people always have to say, I hear Hollard always talking about these wellness and preventative tests that they do cover for me, but what are these tests? So basically on the app, you will go under coverage, you will download the Hollard Health Preventative Care Tests covered. Okay, it will list all the tests that are covered for you. You share that with your healthcare professional. When you share that with your healthcare professional, you do ask them to provide you a quote. Okay, once they provided you a quote, you send that quote to the client services team, or you can do this via the app under requests. You attach that quote, you send it through to the team will then grant you a guarantee of payment. This is aimed at making it a seamless process for you to have these tests done. Okay. Once you've received your guarantee of payment, you can then share that with your healthcare professional, which will then, allow you to have those tests done as seamless as possible. The test that I was mentioning or that are mentioned on the document that I just discussed with you, are what we refer to as routine physical adult examination tests. Okay, those tests include your medical history review, vital signs assessment, physical examination, and general physical exam. So your heart, your lungs, abdomen, your skin, etc. Your height and weight, waist circumference, and body mass index calculation. And other tests that are also included annually, it will be your urine analysis, your cardiac risk test, your fasting glucose, your fasting lipogram, as well as your HIV, rapid HIV antibody test. We also do cover additional tests depending on how you had or when you have joined Hollard and whether you've had your wellness and preventative tests. So over and above the tests that I've just aforementioned, these tests are also covered in addition. That is your full blood count, kidney function, liver function, serum uric acid, as well as your high sensitivity C-reactive protein tests. These tests under the additional blood tests or labeled, displaying on the screen now, labeled as additional blood tests, carry what we call a specific age and time interval. So that is what I meant when I said, depending on when you've joined Hollard and whether or not you've had your wellness and preventative tests done before. If you have, then depending on the age and time interval that has passed, you can then have these tests done again. Again, it is important that I do clarify that these tests displayed on the screen now, they are not in terms or aligned with monitoring an ongoing chronic condition. These are just part of your preventative and wellness screenings. Now, let's say you do go for your wellness, your wellness test, and they do pick up, a condition that needs to be monitored. You monitor the condition, and it ends up being deemed as chronic, and you register as chronic. Should you need to have a full blood count done every quarter, for example, for the management of said condition, then you fall outside of the scope. This is purely for wellness and preventative care. Once you are deemed a chronic member and you've registered your condition as chronic, age and time intervals no longer apply to you. Additional tests that are also covered for women, we cover the pap smear, thyroid stimulating hormone test from ages of 35, the fecal human test from the age of 35, the mammogram, which carries the mentioned age and time intervals, and for the gents, we cover the prostate screening from the age of 40 and the fecal human test from the age of 40. Okay, again, the frequency of the testing or age or both limits only applies where you are asymptomatic. Okay, it does not apply where it is medically necessary for you to have the test or the test is conducted, by means of management or as a means to manage your existing condition. Do we have any questions? Let's see. Philip, there's a question from you that says, where do I find the coverage in the app? Okay, so if you are in the app, you'll go to My Coverage. Under My Coverage, that's where you'll find the document. So My Coverage is the list of documents which has your benefit overview, your policy wording, the exclusions list. The document that we're referring to should be under there.
I'll answer this for Rose. So, Rose, what Hollard are offering in terms of the colon cancer screening is that fecal human HB. That is what I mentioned as it's a microscopic blood test of your stool. So you submit a stool sample to the laboratory. It's tested for microscopic or occult blood. And if that is positive, then you will be referred for further testing, probably in the form of a colonoscopy.
And Rose, that then becomes a diagnostic test. So you've got an initial indication, so you're no longer in the space of pure preventative care. The preventative screening is to identify, is there anything we need to be concerned about? You come out with a result that says, yes, there's something concerning, and then we engage in possible diagnostic tests. So that would be covered, just to be clear.
Thank you, Leanne.
I think the main thing we just want to also emphasize to everybody is that different insurers have different wellness checks covered. In fact, many cover a lot less than us. So if you just go and you show up at the healthcare provider and say, I'm here for my annual screening, they don't know what's covered. When they go into our system, it will say a preventative check is covered, but the full details of what is covered then becomes variable. And that's why we want you to take ownership of the process yourself and to make sure you get those approvals beforehand, to get the list from our site You send that to your provider to say, please send me a quote, send that to us, then you arrive with your pre-approval. Because normally, as Dr. Lorna will tell you, when you go for these preventative screenings, you have to show up not having eaten, you go early in the morning. So we don't want anybody getting hangry while they wait for an approval, okay, at a registered provider. You may want to go to a provider that isn't in our network. That's also fine, but you may want to know for sure what's going to be covered. Am I due for another mammogram? I can't remember when I last had one, etc., etc. So it's still good to get your pre-approval from us that's got your guarantee of payment. So you know, okay, yes, I'm fully covered, or no, I'm not due for another mammogram or another pap smear or whatever. And so you then have all the tests that are covered, and then you have the certainty that you're going to get fully reimbursed. So everything in preventative screening is about taking ownership of your health.
Thank you, Leanne. There's a follow-up question from Rose that does the stool test detect presence of polyps, which, if not removed, can turn cancerous?
The stool test is really a very, very general test. It is just the presence of blood. And blood can, a polyp can have a bleeding, cancer can bleed, something very, very mild can bleed. A little infection in your gut can also bleed. So it is very important also that if you have any symptoms, it's a different, your doctor will do further investigations. So if you have any symptoms of gastrointestinal problems like episodes of constipation or diarrhea or bleeding or bloating or weight loss, those are not, we're not talking in screening anymore. We're talking about getting proper diagnosis, investigation and diagnosis. So I can't really answer your question just to say, oh, the fecal blood test will pick up polyps. Polyps would only be diagnosed on a proper colonoscopy. But if you have any symptoms of colon trouble, you need to be seen to.
So remember, Rose, what we started with here was a discussion about very often in your preventative care, you are asymptomatic. When you have something like polyps, as Dr. Lorna is describing, you will have funny things going on with your gut. So what we're trying to do is not compensate for your normal diagnostic tests, things that are going wrong, the point at which things are already starting to show up. We're trying to make sure that people go and get tests done, even though they may feel they're asymptomatic, even though we call them wellness checks and well person checks, because you think you are well, you are showing up thinking you're well. Okay. But when we start to do these tests, when we start to unpack certain things, then we're going to say, oh, hold on a second, you're not as well as you may think. These other things are going on.
Thank you for that, Leanne. There is a question or rather a comment from Annie that says, this is very insightful presentation. Will you share the slides or the recording? So Annie, allow me, firstly, please check in the chat, everyone. What I've done is I've added a link for you to the Holland Health website. This is where we house important presentations and important videos for you to have a look at. Starting off, this will be your landing page for the link that I've sent to you. Okay, so please do copy it, save it on your desktop. This is your landing page. The landing page has got mixed videos, but at the top here, you can filter the videos. Starting with product and tools. Product and tools allows you to navigate or understand how to navigate the portal, the member app, Health Move and Teledoc, and the introduction just to your product and how your product is structured. Okay, and where we house our webinars that we've done previously, and this one as well will be housed under this part of the website. Okay, so you can go to past webinars where you can watch them and interact. And the nice thing here as well is when you click this button here, you can download it. So depending on, how busy you are at that point in time, you can download any of our previous webinars and watch them at your earliest convenience. But I've just added the link in the chat, which will assist you in having a look at or rather going through the past webinars that we've hosted. You'll see it's quite an array already. But yeah, this one as well will also be uploaded onto the link that I've sent through to you onto our website. Okay.
I think what's nice to note is one of the very first webinars we did, Nola will scroll down a little bit, was on nutrition. So the doctor was talking to you about things you can do to maintain a healthy diet. This whole webinar is just about nutrition. So if that has sparked something in you to look at making some change, this does give you a lot more information about that as well. The men's health matter one, which you can see just to the right there, that one also gives you a lot more information specifically about the type of illnesses and things that men need to be looking out for as well.
Thank you for that, Leanne.
Okay.
Oh, one more thing for me to mention. It's available in 3 different languages as well.
Yeah, and remind your colleagues as well. You know, if you watch this and you found it valuable and you think, sure, I wonder why my colleagues didn't come, please also share it with them as well.
Okay, I've just checked the chat. We don't have any more questions. So please allow me to thank each and every one of you for taking the time to join us this afternoon. Again, thank you for joining this informative session. So we do hope that today's session was insightful, and we'd also like to give a special thank you to Dr. Lorna McCrindle for your informative, session and information that you've shared with us today. We hope today's session has encouraged you to prioritize preventative healthcare and take proactive steps towards protecting your long-term well-being. You'll be able to rewatch, as I've mentioned, this session and all the other previous sessions that we've had on our website. Before we go, though, a reminder that our next session or our next webinar will take place on the 17th of June as part of Women's Health and Hormones theme. The session is titled Cycles and Success: Navigating Hormonal Changes While Building a Thriving Career. Again, thank you very much for spending your time with us this afternoon. Have a great one.
Thank you. Thank you, Dr. Lorna.
Thank you, Dr.
Thank you,
Lorna.
everyone, for joining.
Bye, everyone.